Our health system is facing a desperate situation. Private medical care is expensive, government hospitals are overcrowded, ambulances take a long time to arrive, medicines run out. We are weighed down by many diseases which are too expensive for our health system to treat. But most troubling is the unnecessary loss of life. These experiences are shared by millions of South Africans.
Mina into engiyibone esibhedlela nginokubona ukuthi sometime kuba neline enkulu ma unomuntu ogulayo.
The problem is the clinics aren't open every day.
See, my problem is that to come to the healthcare, I've got to travel far, get up very early in the morning while it's still cold, and it's so inconvenient and time-consuming that we don't know how we can help ourselves.
I-queue yinde kakhulu ebhedlela zethu. Futhi ne-medications kwesinye isikhathi asibi nayo.
You must have imali yokuthi ufike la. And mawunganayo uzohlala njengalama pain lawa until you either die or you survive it.
It's here in hospitals that doctors traditionally treat patients, trying to cure disease after it's found. But the system can't cope, and change is needed urgently.
According to the WHO, millions of people still have no access at all to healthcare. Millions more are forced to choose between healthcare and other daily expenses such as food, clothing, and even a home. Now, this is why the WHO is focusing on universal health coverage for this year's World Health Day, celebrated on the 7th of April. Now, the theme for 2019 is simple: health for all. And the message is that universal health care is attainable. So how far is South Africa from attaining universal health care? What is the current state of our healthcare system, and what needs to be done to accelerate attaining universal health care? Well, that's the focus of today's show. We take a close look at healthcare in South Africa. We'll be joined in studio by a public health medicine specialist from the University of Pretoria, the chairperson of the South African Medical Association, or SAMA, the provincial manager of the Treatment Action Campaign here in Gauteng, the president of the Democratic Nursing Organization of South Africa, or DENOSA, the Deputy Director General of HIV and AIDS, TB and Maternal, Child and Women's Health from the National Department of Health, who will be joining us from our studio in Pretoria. Now, please be part of the show by asking the panel some questions or simply just sharing your views with us. The number to call is Johannesburg 714-6918 or 6919. You can also tweet us at SABC Health Talk or simply interact with us on our Facebook page, SABC Health Talk. So sit back, relax, and learn from this bumper show coming to you just after a short break. I'm Dr. Sello Mutaung, and this is Health Talk.
In a UN report, scientists say climate change is getting worse.
1/3 of our food sources for the population come out of the ocean.
We spoke to people who have been directly affected.
We have lost a lot of cattle. Gemsbokvlakte, Tosca gebied and Jakkalskop. Everywhere you will see there's animals dying.
I've lost 2 of my cattle this January.
Africa's demand for clean drinking water is rising.
Drinking water is a top priority.
The next day when the water comes back, it's dirty.
I have implemented a level 5 water restriction, effective immediately.
Environmentalists seek solutions to preserve the planet.
This is Cape Kirpa, which is also one of the endemic species that is only found within the Western Cape, so it occurs nowhere else in the world except in our water systems.
It's not about xenophobia.
There are many issues of service delivery, housing, illegal mushrooming of structures.
They are now starting to move to Sandton and to submit a memorandum.
You're not going with ties there. That's all.
I will stop this mud here. When we're bending tires in the inner Alexandra, they kept quiet because now we are going where they report. That is why they are having a problem.
We feel really undermined and disrespected that he did not show up to listen to our grievances. He has grown a tendency of only serving the so-called white monopoly capital and has forgotten about black communities. Development must happen either or of all sides because we are equally Batu.
But the people here today are saying service delivery to us, we deserve it.
This is Sivananda Clinic in Inanda, KwaZulu-Natal. Despite not having a full-time doctor and only a handful of professional nurses, it offers life-saving services to 38,000 people. When people come into the clinic, they get checked up for everything and are told how to stay healthy.
Sifuna ukunciphisa izinga labantu abaye ibhedlela. Yikho konke sikwenza kuma primary health care ukuze abantu abaye ibhedlela kuba abantu abancane sibalapha khona la yikho sinako konke ukwelapha.
The aim is to treat and manage illnesses before there's a need for complicated and expensive treatment at a hospital. This is how it's hoped all clinics will function in the future. There have been fewer children born with HIV in the area and a dramatic drop in childhood killer diseases thanks to their successful immunization program.
Hey, sorry baby. Futhi zincane ingane esezifa ngenxa yokuthi omawazo abaye emtholampilo bayothola ukuqhukuzwa besakhulelwe ayisekho ngoba sebeyaxukuzwa konke sikwenza la clinic. Zincane futhi ingane esigomayo, ziningi ingane esigomayo. Ngakho izinga lokugula kweingane ez under 5 years sekwehlile kakhulu. Nezalukwazi ezilanda amaphilisi okugula njengo BP o hypertension noshukela. Konke sikwenza la clinic nemshanguzo yabantu abanoshukela iyatholakala la clinic kanye neasthma kanye neepilepsy sifo sokuwa kuyatholakala la clinic. Ngakho izinga lalabo bantu lehle kakhulu ngokwezibalo esizibalayo njalo makuphela inyanga.
There are 12 million school-going children in South Africa. Targeting them whilst they're young will ensure they can grow up to be 12 million healthy adults and reduce the amount of disease our system has to fight in the future. So, the new primary healthcare system won't just rely on clinics, but will also have a schools program where learners are taught about health.
All right, so let's get into it now and look at, a closer look, obviously, at the healthcare system in South Africa. And to help us with that, we have a special guest. First up in our Joburg studio is Dr. Thabo Soweto, who's a public health medicine specialist from the University of Pretoria. And welcome to Health Talk, Dr. Soweto.
Thank you very much.
All right. And joining us from our Pretoria studios is no stranger to this show, Dr. Jorgen Pile, who's the Deputy DG of HIV and AIDS, TB and Maternal and Child Health and Women's Health, from the National Department of Health. Welcome to Health Talk once again, Dr. Pile.
Thank you very much, Dr. Matong.
All right. So perhaps let's start. I mean, obviously we're taking a closer look at our healthcare system in South Africa, and clearly it's going to be quite a fair amount of time that we're going to be focused on, challenges and so on. But lest we forget, there's the other side as well. We've had successes over time. Can you perhaps just take us through some of the successes that we've achieved so far?
Dr. Matong, you're absolutely right. While we need to focus on the challenges, we also need to record some of the successes. And what's fairly clear is that between 2009 and 2017, life expectancy in South Africa has increased despite the burden of disease. So in 2009, on average, people in South Africa, men and women together, lived for about 57 years. And that's quite short by international standards. In just short 8 years later, by 2017, this has increased to 64 years. So people in South Africa are living longer, and we do know why. Apart from the fact that people have more access to water, sanitation, better education, people did have better access to healthcare with specific reference to, for example, the HIV program. And most of the commentators will tell you that much of the increase in life expectancy is a result of large numbers of people, at present 4.5 million South Africans, being on antiretrovirals. The second is a significant decrease in children under 1 who died. In 2009, 39 per 1,000 live births were lost. Fast forward to 2017, the number is now 23 per 1,000 live births. The same with under 5 mortality. That's decreased from 56 per 1,000 to 32 per 1,000 live births, as well as maternal mortality, where we've seen a fairly dramatic reduction in maternal mortality rates from 302 per 100,000 deliveries to 134 per 100,000 deliveries. So clearly we've made a big difference in both the numbers of people who are dying prematurely, and that the consequence of that has been people in South Africa are living much, much longer than in 2009.
All right. Let's come back to our Joburg studio and speak to Dr. Makula. Dr. Makula, perhaps you have 1 or 2 areas to share in terms of successes that we've achieved over time. Do you want to perhaps, add, or, if at all, to what Dr. Pillay said?
Okay, thank you very much. Good morning to you and good morning to the viewers at home. And I think just following on to what Dr. Pillay has said, I think indeed we've made quite progress with regard to the performance of the health system. And I think I need to also state up front that it's sometimes quite difficult to mention, especially in ordinary discussions when people say, the health system is crumbling, because I think most of the time we are actually not very clear about exactly what we're talking about. But in this case, I think in South Africa, in terms of life expectancy, in terms of maternal mortality ratio, infant mortality, those are key indicators that tells us whether we are actually making any progress or not. So from what Dr. Pillay has already said, I think it confirms the fact that we have made some progress. Challenges do remain, but definitely we have made some changes. And I think it's important that we simply make sure that we maintain and even make sure that we strengthen where we have been able to get things right. So the issue is that we are making progress and we need to strengthen our progress going forward.
So you mentioned challenges. Perhaps let's start with just the structural issues of our system. In your view, I mean, looking at it from a public health specialist point of view, what are the areas perhaps where you think we could be doing things slightly differently?
I think the first area that we definitely can be doing better is in terms of how we allocate resources. We are investing quite a significant amount of resources into our health system, and we could do better in terms of improving the efficiency and the allocation. If you look at the public health system, if I were to just for a moment look at the public health system, the majority of the allocation is actually in the provincial departments of health, and I think there's something to be said about improving efficiency at those levels to make sure that rent for rent we get value for money. That is, in terms of how much we put into those provinces, we should be able to say, yes, we've been able to get good population health outcomes. And I think it's important at this stage to also mention that when we talk about the health system, there are the 3 key issues or 3 key objectives of the health system. You're talking about population outcomes, and you're talking about responsiveness, and you're talking, you're also talking about fairness in contribution by the population. So if you look at
contribution in what sense?
Contribution in terms of whether families and individuals are expected to contribute according to whether they are able to, in terms of their means. Correct. So that we don't find that patients or families have to decide between whether they are going to spend their money on health or they are going to spend their money on other things, as you mentioned in your intro, about food and other necessities. So it's important that as a country we need to have a very clear understanding that if we are not careful about these things, especially the poor and vulnerable will end up spending much more on health than on other things. So it's very important that when we reflect on how well the health system has performed, we look at the issue around population health outcomes, which is already mentioned by Dr. Pillay, but we also look at to whether the health system is actually meeting the expectations of the populations it's supposed to serve.
Right.
But on top of that, that there is actually fairness across the population in terms of how people contribute towards financing the health system.
Right. Let's get back to Pretoria and speak to Dr. Pile again. Dr. Pile, you've heard what Dr. Makola has said in terms of perhaps in the area of allocation of resources. I'd like your comments on that. Could we be doing things better? What are the actual challenges there?
No, my colleague is absolutely right. We can always do better. There are a couple of areas where we really need to have a look at. The one area is prevention. It's quite a big challenge that 70% of women in South Africa are either overweight or obese, and a third of men are either overweight or obese. Now, and those are the kinds of things we know we can do something about in terms of prevention. So in terms of the allocation of resources, we do need to focus more on prevention, primary prevention as well as secondary and tertiary prevention. The second is around efficiencies. I fully agree that both the public and the private sectors in South Africa can be significantly more efficient. If you look at the distribution of resources, human resources between the public and the private sectors, with 80% of people in South Africa depending on the public sector, we have about the same number of specialists, medical specialists, in the public sector compared to the private sector. In the private sector, we have over 7,000 medical specialists, and in the public sector, just over 6,000. Now, that kind of distribution obviously makes it very difficult for the public sector to provide good quality care if you just look at the number of specialists and medical practitioners that need to take care of larger numbers of patients.
Yeah.
But that said, our facilities can be run more efficiently, starting, Dr. Motang, with very simple things, fixing up the filing system, decreasing waiting times, providing clean facilities, and then, of course, focusing on clinical quality of care. And the surprising thing is that on all of these issues, we know what needs to be done.
Yeah.
It's really ensuring that it gets done and holding people accountable to getting things done.
We're going to get back into what needs to be done. And perhaps before we go for a break, let's take Lucky on the line from Soweto. Lucky, welcome.
Morning, sir.
Morning, Lucky.
Morning, yeah. No, my complaint is about the hospitals, man. These long queues. You get up very early in the morning, you go and stand up in these long queues.
Right.
And at the end you are told, there's not enough doctors or medication.
Yeah.
This is a problem in hospital.
Okay.
And the untidiness of the hospital. Hospitals are very, very dirty.
Okay.
They are called health centers. Last time I was in the North End Hospital, where I heard the doctors talking about complaining about the services also there,
Yeah.
And they said the MEC was coming to visit the hospital. Why should the MEC make it known to the hospitals when she's coming? She's supposed just to turn up without, telling the staff. But the untidiness, sometimes no running water in the hospital.
Okay. Lucky, thank you so much for, I think we get the gist of your call. We're going to be focusing on all of those issues that you've mentioned, looking at the quality of services, the state of our facilities, and so on. But that after the break. Please stay with us.
Professor Adam Habib has penned a book titled Rebels and Rage, reflecting on fees must fall.
The students achieved in 10 days what vice-chancellors were debating for 10 years.
It's the first time in 4 years the price of petrol is going up by such a large amount.
It's not only a horror show for motorists, it's a horror show for consumers across the board.
South Africans can expect some light at the end of the tunnel. Lights will stay on during the coming winter months, following nearly 2 weeks of stage 4 load shedding last month.
The load shedding is there to release pressure off the grid. So nobody, not you, not me, not the minister or the CEO of Eskom, can dictate how much load shedding it should be or not be. The system dictates how much load shedding is necessary to stay alive.
Get the facts first.
In 1994, ek dink ons is almal
Was ek ook baie excited geweest.
For South Africa, art was never a good thing.
From a footballing point of view, there was never a separation.
Get to the truth.
There's still some serious issues in South Africa.
Maar ek dink die regering kan regtig probeer om harder te werk om
ke apartheid in Sutlile ke le ke swa ke batho ba rena ba democracy batho ba batsho iseng makgowa.
See what it all really means.
Ek is geel want dit is die kleur in die verkeerslig wat vir jou sê wees versigtig.
I still give South Africa red.
We are somewhere in between.
We're giving our democracy a green for sure. We're very happy.
Democracy Gauge, weekdays at 5:30 on SABC News, Channel 404.
In order to improve the quality of healthcare provided by hospitals and clinics, the Department of Health has set up the Office of Health Standards Compliance.
The office is to ensure that certain basic health standards are adhered to by all facilities at all times. And those basic standards are cleanliness of the institute of the health facility, the attitude of staff to patients, the safety and security of staff, infection control, the waiting times, and drug stock outs. At all times, those things must be resolved, and the office is going to make sure that facilities do not ignore those.
The office, through 3 main mechanisms, will aim to ensure that health facilities meet certain standards of care.
There will be a unit of inspectors who will go to health facilities unannounced. There will also be an ombudsperson where patients will complain. Patients will be knowing about these standards. And if that facility doesn't adhere to them or they get wrong treatment, then they'll report to the ombudsperson. But facilities, the 3rd unit will also be a unit that certify facilities, and say, no, this facilities is up to standards at all times.
A key part of the program is providing training to administrative and managerial staff at health facilities.
We have been holding workshops and training sessions in all provinces to explain to managers what the standards are and how they need to meet them, how they need to comply with them.
Inspectors will go out to assess how well hospitals are meeting the 6 priorities.
What I'm checking here is whether this is general waste only, and what I found that it is general waste, so it's in the right.
They go out to visit hospitals or clinics, and they go through this questionnaire with the managers in the clinic and with the patients and with the staff, and they also look around and they fill out all the scores on this questionnaire, which is made in such a way as to tell us whether that hospital is actually meeting those standards, whether it's providing good quality care.
All right, so we're going to get the public's experience, with respect to the quality of our care. And we still have with us here in Joburg Dr. Tokomakola, who's a public health medicine specialist from the University of Pretoria. And by the way, who's also program manager for the Albertina Sisulu Executive Leadership Program on Health. And we're now joined here in Joburg studio by Sinazo Didiza, who's a provincial manager of the Treatment Action Campaign, or better known as TAC, here in Gauteng. Welcome to Health Talk, Sinazo.
Thank you for having me.
All right. And of course, in our Pretoria studios, we still have Dr. Yogan Pile, Deputy Director General of HIV and AIDS, TB and Maternal, Child's and Women's Health from the National Department of Health. But let's get back to, and start with you, Sinazo. We've seen the clip. We've heard people talk about, describing our healthcare system. You're the voice of the people. What's the experience of the public with respect to the quality of care that we see in this country?
All right. Thank you so much, and good morning to the viewers. The experiences of people at ground level in terms of accessing public health services, there are gaps in terms of accessing services. For example, patients, and they experience long waiting periods. They go there at 4 a.m. when services actually start at 8. And also, there are staff attitudes that are in place. And I must say, when it comes to staff attitudes, it's a barrier in terms of accessing health services. And remember that access to health is a basic human right. And having those staff attitudes prohibits people from accessing or exercising that right. And another challenge that people have experienced is the issue of missing files. The filing system is still not so perfect. It needs to be improved. You will have a patient having more than 5 files in one facility, and that is also a barrier in terms of accessing services. And I also want to mention the issue of medicine stockouts, essential medicine stockouts. We have experiences where people, they are turned back because there is no medication. An example of that is the ARV treatment. We've had people who are turned back because there isn't enough stock, and that has got an impact in terms of adherence to HIV treatment.
Yeah. So in your view, is this a generalized problem, or is it something that's experienced at a few of the facilities?
I would say in terms of staff attitudes, this is something that has become a norm across the country. I mean, if you go and access services, you know that, okay, I'm going to be subjected to this treatment. And then when it comes to medicine stockouts and shortages, this it differs in terms of the areas. There are areas who do not have problems with stockouts, who don't have problems with shortages, but there are areas where they severely experience that burden of stockouts.
All right. Before we go over to Pretoria, let's speak to Thabo on the line, also from Pretoria. Thabo, welcome.
Hi, Doctor. I am actually an ambassador for the Department of Health, the National Department of Health.
Okay.
But yeah, my heart is heavy as I'm sitting here right now.
Right.
I have lupus, of which it took my doctor 2.5 years to diagnose it. I came out with an idea of raising the awareness. I got a letter of endorsement for the lupus awareness, which is taking place next month. Suddenly, I get the runarounds from the head office. The letter is signed. I have it with me. And I'm ready to actually distribute the letter to all the media platforms so that they can see how we get treated. Whether you are an ambassador or not, lupus has killed so many people unaware that they have lupus. And it's even affecting people now unaware that they have lupus.
All right.
So my question is that Dr. Pile spoke about it's better to get the cure before you actually, things get worse. But now we're trying to raise their awareness. But they are not coming on board to assist me.
Okay. Thabo, thank you so much. We get the gist of your question, and let's go ahead and speak to Dr. Pile. Dr. Pile, perhaps let's just focus on the issues that have been raised. Of course, including the issue that's been raised now about prevention and how people can participate in raising awareness as part of prevention. But just in general about, you've listened to Sinazo describing at least the public's experience of the quality of care that's delivered against, of course, the Office of the National Standards. We have standards that we need to, at least work towards. Your views?
Dr. Matong, thanks very much, and thanks to the colleagues for raising those challenges, which are real challenges. But they happen in pockets, where you have a very good facility manager. Despite the resource constraints, you will find that facility does reasonably well. With respect to complaints versus compliments, I think, just to get another view on it, we have a program called Mum Connect, which the minister launched in 2014, which allows pregnant women to register and get messages that are related to the stage of their pregnancy through their cell phones. And we also get spontaneous reports of compliments and complaints. And throughout the last 3 or 4 years, we've been getting 6 compliments for every 1 complaint. And these are not solicited by us, they're volunteered by pregnant women.
Yeah.
But what we do know is the complaints from pregnant women are really around basic things. exactly what our colleague in the studio has said, around attitude of staff, around shortages of medicines, cleanliness, waiting times. Those are the 4 key things. With respect to shortages of medicines, we have at the clinics instituted a program called the Stock Visibility System, which allows us in the National Department to look into every facility, every clinic, to see what stock levels they have. So we are able to monitor and shift stock around. But of course, that does not mean that you'll always have stock in a facility, because we also have supplier-related challenges where the supplier of a particular product doesn't have the stock in the country.
Yeah.
But what is key for all of these things is around communication.
Right.
And I think we have also accepted that we need to communicate more effectively with communities and our patients and allow the patient voices to be heard more clearly.
Right.
And this is something we've been working quite hard on.
Okay. Well,
in the
talk
last few
about
years.
patients' voices. Let's hear another patient voice, this time Georgina from Tsakani. Georgina, welcome.
Good day, sir.
Hello, Georgina.
I would like to say, on the shortage of medicine, let the medical council allow people who are inventors, who are out there, to come in on trial. Maybe you don't have money, but you can defeat other diseases. Then let the medical council allow you, even if you are not well educated, because the registrar, I don't mean to offend them, but they take what you have. You don't own it. You see your stuff is working out there. It's been a production of the worldwide. What do? If you have a supporting document, you have copies, you have gone everywhere. South Africa was going to be helped in the shortage of medicine, if they can do that.
Okay. Georgina, thank you so much for your comments. But let me give you the last few seconds, 30 seconds, to each of you. What would you like to see happening going forward, based on what you've just said?
I think what I would like to see happening is for our policies that are meant to improve healthcare systems be implemented at ground level.
Yeah.
The policy implementers, they should understand what those policies mean as they go down into ground level.
Okay.
And also, lastly, I would like to see maybe some health services being more affordable. For an example, cancer treatment, whether you are a private healthcare user or a public healthcare user, but access to cancer treatment is quite expensive and is not affordable. Right. Perhaps there could be changes in terms of laws, patent laws, in terms of accessing medicines in that place.
Well, Sinazo Titiza, thank you so much for your time.
Thank you.
Dr. Makola, I know that I haven't spoken to you now, but we've just run out of time. But I promise we'll speak in the next segment. Time for another quick break. Please stay with us.
Thank you.
Thank you.
The SABC News mobile app is your one-stop digital portal to all the news you need. Stay connected with the latest in breaking news. Watch the SABC News channel along with clips and live streams of all the big news events. And listen to all the SABC News radio stations live, including podcasts and much more. Simply download the SABC News app to your Android or iOS device from either the Play Store or the App Store. SABC News, independent, impartial.
The Zimbabwean government says it's now planning to give compensation to white farmers who were forced off the land they occupied by the government of Robert Mugabe.
For reasons of political expedience, this attempt is driven by opportunism and is bound to further deepen the political and economic crisis in Zimbabwe.
A small group of people chanted Makashule's name at the launch in Sandton City. They allegedly ripped apart some copies of the book and threw the pages around.
Clearly that book wants to divide South Africans.
We wanted to make it very clear that we stand by this book and we stand by Peter Louis Myburgh as an outstanding author.
Did you know the big hole digging started in 1871 and ended on the 14th August 1914? The hole produced 2,722 kgs of diamonds. However, one diamond as huge as 490 carat of stone found in the open prior 1868 gave them the interest to dig. extracted from 22.5 million tons of soil. Today, the hole sits at a breathtaking 214 meters deep. Kimberley Big Hole attracts tourists from all over the world, taking a vintage tram past the city, then cycling around the Big Hole.
Okay, welcome back and thank you so much for staying with us. If you've just joined us, we're taking a closer look at our healthcare system in South Africa, and with our guest in our Pretoria studio, Dr. Jürgen Pile, Deputy DG from the National Department of Health. Now in our Joburg studio, we're now joined by two other special guests. First up is Dr. Angelique Coetzee. Dr. Coetzee is the chairperson of the South African Medical Association, also no stranger to this show, I must say. Welcome to Health Talk, Dr.
Thank you.
Right.
Thank you for having me.
And with Dr. Coetzee is Simon Hlungwane. Hlungwane is the president of DENOSA, of the Democratic Nursing Organization of South Africa. Of course, well known, no need for any introduction. Welcome to Health Talk, guys.
Thank you very much, and thank you for having us.
All right. So we've just heard, I mean, you know, in our discussions earlier, and we've heard at least just now about the public's experience, you know, with respect to how they perceive the quality of healthcare services. And perhaps just as a start, one of the main things that have come up, you know, consistently is the issue of staff attitudes. Let's start with you, Dr. Coetzee.
Thank you, and a good morning to all the listeners out there. And let's see what we can manage in this session. Yes, it is true that the attitudes of the staff, especially the doctors as well, we're not excluding anyone here, right. Can be sometimes seen as very rude and inappropriate. So what we from SAMA side is saying that if you look at the working hours of the medical profession, the hours are much longer than what is being suggested by the labour law of South Africa. So then that brings you to unnecessarily high working hours, relating then into putting pressure on those doctors and nurses. That again leads to them not being able to cope with the patient load. It leads to things like drug abuse, alcohol abuse, insensitivity towards the patients, burnout. In this process, once they reach the burnout stage, most of the doctors will then start to become detached of their patients, and it just become a work that you are doing. So one thing, again, it is the working load or the working hours that they are working. The other thing that can play a huge role is the environment that you are working in, expose not only the doctors but the medical personnel to diseases like your HIV, your TB, your hepatitis. So there's a real risk of putting another strength or another burden on this. Then on top of it, I think it's not only common to South Africa. I think it's a thing of the new generation, the young people, where we as the older people, we learned that we have to communicate with people, we have to interact. The younger generation interact via cell phones, social media, and I think they start to lose the important thing of how to touch a patient, how to communicate.
Okay. I want to speak to Simon, because the other thing I'd like us to then unpack is how all of these, you know, issues that we've spoken about are related to the healthcare system. But before that, let's speak to Gogo Rose from Soweto. Gogo Rose, welcome.
Thank you.
Your quick comment or question, please.
Yeah, you know what? The government must take care of South Africa.
Right.
I mean, our hospitals, they cannot cater for the whole world, the whole of South Africa. No, they can't do it. Okay. You know, I'm a patient at Bara. Yes. I'm always there and I always check. Even the outside people, they are laughing at us. They tell us you won't do nothing with us. We are coming here to your hospital free. We get everything we want. I mean, it's not right. They must do something. They must see that not everybody must just come here and stay here. And me, I was born in Soweto, 1934.
Right.
And I was one of the people who struggled for our for our South Africa.
Okay.
Our people, they used to go to Zambia, Swaziland. They used to stay in camps.
Okay.
Not like now. All the people from outside, they want houses. They are staying in shacks and what they do, what they like here in South Africa.
Okay.
I'm very cross for
Okay,
our
Gogo
South
Rose,
Africa.
we understand, and thank you so much for raising this. In fact, it's something that has been raised a number of times, the issue of whether or not our healthcare system is adequate enough to take care of South Africans and other, foreign nationals. Let's hear. We'll obviously pass that on to Dr. Pile as well. But let me get your views, Dino.
Greetings to the listeners, and as nurses of South Africa, we are committed to saving the nation of our country.
Right.
But I think the point raised by Gogo there in Soweto, it's fundamental to say what does it impact on our health system in general.
Right.
And I want to start my point from the point where Dr. Pillay has mentioned the issue of the Mom Connect. I think he said out of the one out of the six feedback they get from the Mom Connect, 6 are compliments and 1 is complaints. But even though it's 1 complaint, if it's about staff attitude and all that, it's 1 too many. We must acknowledge that fact.
Right.
And therefore, we must then say we should be committed to addressing that issue. Now, the question will be, what programs do we have to address it? And for you to address the problem, you must to address an issue, you must understand what is the problem. So there are issues or matters that causes the problem. And it's a systemic issue. One, things that used to be there in the past are no longer there. Things like, if you look at the conditions of employment at the current moment, is that you have a high shortage. And I think she has mentioned very well. Now, when you have a high shortage, you're supposed to be in a ward. I'll give you an example of an ICU in Charlotte Maxeke. It's a 12-bedded ICU, so you admit only people who are ventilated. It means they need 1 nurse for 1 bed. But in each and every shift, they only have 6 nurses. It means they will either stretch to see how do I assist there, or they will then have to cope with getting additional nurses who are doing overtime. What does it do? Nurses don't rest, those who are supposed to be assisting in there. But that is just one simple example. You go to rural areas, you get to a clinic where they are seeing a lot of patients in a day, but they have a lot of patients that are coming through and you have only 1 nurse to service the area. But these conditions that have come here have been caused by us, because after democracy, we've opened porous borders, like she has mentioned, Gogo there. Now, the number of patients that we used to see in the past has increased. But don't forget that at some point we had a population of 47 million. Currently, we're talking about 57 million. The population has increased. What has it done? It has increased the burden of disease, the burden on the healthcare, including the burden of disease. In the past, there was no HIV. Now there is HIV. And I think Dr. Play has spoken about the issues of the non-communicable diseases, the obesities, a lot of issues of accidents and all that. All that is adding a strain on the healthcare. What have we done in the healthcare sector? Things like clinical teaching departments has been taken away. When you are burned out or you experience a trauma experience within your workplace, you have nowhere to go for counseling. Just 2 weeks back, a nurse was shot dead in a clinic gate, in a hospital gate in KZN. Those who experienced it, including the security people, have nowhere to go there for counseling, because they saw somebody being shot in their presence. Now, those little things have been taken away, including failure to increase the number of staff, nurses, including support staff like the cleaners, the porters, and so on. It has all been taken away because there's been a freeze and a moratorium of employment of nurses. As we speak in Limpopo, there's 271 nurses who completed community service. They went for a 4-year training, degree or a diploma. They did a 1-year program of working as a community health nurse, community health professional nurse in a community. After which, when they are done, the department says, we don't have money, go and stay home. but they are needed in the communities where they were working last year. Yeah. Now, it adds a strain in the whole system. It then says there's a burnout in the staff in the hospitals and the clinics.
You know what? You're raising a number of very, very important issues. I just wish we had a lot of time, but I promise you one thing. Within a few weeks' time, we're going to be looking at nursing in South Africa.
Yes.
And I'd like to invite you back to come and discuss all of these issues.
I'll hold you to it.
You can take my word for it.
Thank you.
For now, thank you so much for your time. And, of course, we'll speak to Dr. Pile afterwards when we talk solution time. What do we do going forward? Please stay with us.
It's not about xenophobia.
There are many issues of service delivery, housing, illegal mushrooming of structures.
They are now starting to move to Sandton and to submit a memorandum.
You're not going with tires there. That's all. I will stop this march here.
When we're burning tires in the inner Alexandra, they kept quiet because now we are going where they report. That is why they are having a problem.
We feel really undermined and disrespected that he did not show up to listen to our grievances. He has grown a tendency of only serving the so-called white monopoly capital and has forgotten about black communities. Development must happen either or of all sides because we are equally Batu.
But the people here today are saying service delivery to us, we deserve it.
Get the facts first.
In 1994, ek dink was ons almal was ek ook baie excited geweest.
For South Africa, art was never a good thing.
From a footballing point of view, there was never a separation.
Get to the truth.
There's still some serious issues in South Africa.
Maar ek dink die regering kan regtig probeer om harder te werk om
ke apartheid in Sutlile ke le ke so ke batho ba rena ba democracy batho ba batsho e se makgowa.
See what it all really means.
Ek is geel want dit is die kleur in die verkeerslig wat vir jou sê wees versigtig.
I still give South Africa a hate.
We are somewhere in between.
We're giving our democracy a green for sure. We're very happy.
Democracy Gauge, weekdays at 5:30 on SABC News, Channel 404.
Please, short, sharp, don't tell us stories. Just get to the question. Just hold on.
These
just
are
hold
the
on.
things
Please hold
that
on.
are caused
Please hold
by
on.
people
Please
who do
hold on.
these sort of things.
So, but we'll get to the floor. We'll get you an opportunity to ask these questions and interrogate these leaders. The people are saying you are talking, and it's all rhetoric at the moment, but there doesn't seem to be any action to back that up.
Okay, welcome back. We're having quite a lovely discussion here around, obviously, our healthcare system, and we have our guest, Dr. Thoko Makola, public health medicine specialist from the University of Pretoria, and in our Pretoria studios, Dr. Jürgen Pile, Deputy Director General, HIV and AIDS, TB, Maternal and Child, and Women's Health from the National Department of Health. Before we start talking about solutions going forward, let's take Thabo, our last caller, I think it will be, Thabo from Soweto. Thabo, welcome.
Thank you, Doctor. Good day to you and the listeners and your panel.
Hello, Thabo.
I've got a question.
Right.
We normally say that we must work smarter, not harder.
Yeah.
In the health services, I'm a bit worried about the budget that we are not using properly. For example, yesterday I was at Charlotte Maxeke Hospital in Johannesburg.
Right.
There is a I don't want to use it as a homophobic or the foreigners. I don't want to call that. But let's be responsible, guys, because we know our rights. You got a guy who goes to a hospital. He's owing the Charlotte Maxeke Hospital 25,000. And then you got a local citizen of South Africa, an old lady who's a pensioner. He's owing 200 rands, and she was denied that, to get medication, and she was told that she must pay that 200. And yet this guy, who did not even have an ID, he did not show the ID at the window. He was allowed to collect his medicine, and yet he's owing. He's a debtor. He's owing the hospital 25,000. This guy is a good man. He's a Nigerian. You can see the way he was dressed that he's doing well. But then they're undermining our facilities. Our own people who are employed, the civil servants that are employed at those windows, I don't know, are they getting something once they allow them to exploit us? And yet the earlier caller mentioned that in the time of when people were in exile, we also respect the laws of their countries. We're not allowed to rule as we are ruling now. We're not allowed to, yes.
All right. Okay. Thabo, thank you so much. I think your point is well made, and we're gonna obviously get some responses from our guests. Perhaps let's go straight to Pretoria and speak to Dr. Pile. Dr. Pile, I think this issue of foreign nationals and our healthcare system, is one that comes up consistently, and I know that there's been responses there and there, but what are we doing about this issue?
So, one of the things from where we sit in the health department is that if a patient comes to us and the patient requires care, we are obliged in terms of ethics, medical ethics, to provide the care.
Yeah.
It's very difficult not to provide care to people who need it, regardless of, whether they're foreigners in South Africa as legal citizens or not.
Yeah.
So, one of the things we've been doing, and with the Department of Home Affairs, for example, is to try and figure out, how the control of people in and out of South Africa can be better managed, because really that's what we need to focus on.
Right.
We're focusing on the wrong thing if we are focusing just on what happens in health facilities, even though we acknowledge that it increases the burden on our facilities, it increases the burden on the resources we have. All of that's true. But we really have no choice as the Department of Health. So this is a government-wide issue, and government is looking at solving it across government departments.
All right. So let's then look at, first, quality of our healthcare services. We've heard all the issues raised in terms of, the quality from a public's perspective. What are the priority areas, and what are plans, that we have going forward?
So, Dr. Matong, let me say a few things. You will recall that in October last year, President Ramaphosa hosted a 2-day meeting called the Presidential Health Summit, at which all of the stakeholders in the health sector, public and private, were able to ventilate and articulate what they think the challenges are, as well as what they think the solutions are. So the next steps after the summit was to set up teams to look at specific things, which includes quality, access to resources, etc. And those teams have been working quite hard since then to put together what has been called the social compact, which once it's complete, the president will formally launch with leaders of the various sectors in the health industry, both public and private. And the social compact will really focus on the solutions on a wide range of areas.
Okay.
And of course, as you know, at the same time, in the presidency, they've created a war room to deal with issues related to the national health insurance, because quite frankly, without a national health insurance or universal health care, as the WHO calls it, we will not really be able to merge the public and the private resources into one pot, merge the private and the public providers into one pot, and provide seamless care to people based on health needs rather than ability to pay for services.
All right. Before we run out of time, I need to give Dr. Makola a chance. Perhaps give us your views in terms of solutions going forward. We've heard what Dr. Pile has said, around obviously issues around looking at the entire system. But specific issues such as quality of care, human resource issues.
No, thank you very much. I think it's quite important that we also recognize that for going forward back to the point I mentioned about efficiency, we need to make sure that we improve the efficiency within the health system. And for that, it requires the fact that stewardship is critical. I mean, the National Department of Health main responsibilities about stewardship over the health system. Right. And I think they need to strengthen that to make sure that people who are running the services in the provinces, at facility level, in the districts, are held accountable for what is actually happening. But also I think more importantly, the structure that we put in place, such as the Office of Health and Compliance, must be strengthened. We must make sure that we've got enough people within the inspectorate to be able to go out into the facilities to inspect. But we must also make sure that we also need to recognize the fact that the health system, like all other systems, they either fall or rise on leadership. And we need to strengthen leadership and management within the health system in totality if we are hoping to see any progress going forward. So in total, we need to really work on the issue of making sure that we get value for money, and we need to make sure that people who are in charge of the system actually understand what the responsibility that they're in front of them, and they do that properly. But in addition, I think also as a country, we need to realize that even in the context of restrained or very difficult fiscal conditions, we need to make sure that we dare not try to reduce our investment in health, because it's when healthy nations are very productive nations. So we need to make sure that it's very important that we continue to invest adequately in our health system and make sure that we can improve its performance.
Yeah. Well, gentlemen, I wish we had all the time in the world, but unfortunately we don't. Perhaps let's just quickly go across to Pretoria. And Dr. Pile, let me just give you the last concluding thoughts, last 30 seconds or so.
Thank you very much. I think we have to work together, public and the private sector, together with communities, to ensure that we prevent diseases, promote health, and seek care as early as possible. We still have too many of our people seeking care too late. We need to also, on the provider side, ensure that we provide respectful care and confidential care, even under difficult circumstances, because our medical ethics, our professional ethics demand that we provide respectful and confidential care to patients. Right. From the Department of Health, the Minister, the DG, and the rest of us, together with the provincial MECs, are committed to do everything we can to provide the best care for people, regardless of whether they're receiving it in the public or private sectors.
All right. Well, gentlemen, thank you so much for your time. That was Dr. Jorgen Pile, Deputy DG from the National Department of Health, and Dr. Thoko Makola, Public Health Medicine Specialist from the University of Pretoria. And to you folk at home, thank you so much for staying with us. We're back on the screens again in a week's time. And until then, please do take care.